Sarah Faye can track her life by flipping through her medical record. As an adolescent, doctors told Faye that she had anorexia. In her 20s, she was diagnosed with generalized anxiety disorder, and later on, major depressive disorder. By the time Faye had entered her 30s, the diagnosis had switched to OCD. However, after a few years, it changed again to ADHD. Oh, and don't forget the bipolar diagnoses, first labeled as bipolar 2 and then swapped out for bipolar 1. Faye's journey through mental illness inspired her book, Pathological: The True Story of 6 Misdiagnoses. Faye began on this journey at age 12. Although she appeared underweight, her anorexia diagnosis didn't take into account the real reason behind her eating habits.
Anorexia is so visible, but my situation was that my parents were divorcing. I was only 12 years old and I was going to a new high school and I was terrified. And I had a terrible, just lurking pit in my stomach. I mean, it felt like a black hole and I didn't want to eat. I couldn't eat. And so is that anorexia is the question, because anorexia, the symptoms of it are obsessively weighing yourself or obsessively being concerned with body image and how you look. I never weighed myself and I wasn't concerned with that. I was a young person. My parents were divorcing and I was going to a new high school. But once I was given the diagnosis, I identified with it. So I was cutting my food up. I learned how to hide my food and make it look like I had eaten more than I had on my plate. And eventually I started to weigh myself and that became obsessive. And I started to think about the way I looked and wanted to have more of that skeletal appearance.
This early teenage experience laid the foundation for Faye to strongly identify with all of her future diagnoses. From then on, Faye embodied each new label doctors gave her.
I identified with each one completely. I mean, I just adopted what they were and what they meant and what it meant to have obsessive compulsive disorder or ADHD or bipolar disorder. And what that looked like was I basically first started to learn what the symptoms were and then started to see those symptoms in myself.
Faye began to pathologize every aspect of her life, blaming any emotion on whatever her diagnosis was at the time.
Once I had a diagnosis and I knew what the symptoms were, so I knew that I was excessively worrying, I immediately saw it as a sign of my anxiety disorder. And then every time I worried, it was a sign, oh yes, I do have this diagnosis. And I never really learned how to process emotion. And I never learned how to relate to my thoughts. Everything was a problem. My behaviors were a problem. And it really became most dangerous once I was diagnosed with bipolar disorder. I think that was when it really became my entire identity.
Faye was never diagnosed by a psychologist until her 40s and on her 6th diagnosis. The previous disorders had been identified by a general practitioner.
And actually, primary care physicians give 80% of the prescriptions for antidepressants. So we're really, in some ways, the conversation about psychiatry and diagnoses and the flaws with it automatically goes to psychiatry, and we attack psychiatrists. And in some cases, that's warranted. But I wanted to give the experience that a lot of people are having, which is that you are in a medical facility with a man in a white coat with a stethoscope around his neck, or a woman, or not, but that's who's giving us our diagnoses. We would never question them. I thought they were 100% scientific and valid and reliable and as medically sound as a cancer diagnosis.
The American Academy of Family Physicians says a majority of mental health diagnoses come from primary care physicians. In fact, 2/3 of people with depression are diagnosed and treated by general practitioners. These doctors are able to help patients who may not be able to afford to see a psychologist. However, Faye says many of these physicians aren't equipped with enough knowledge to give a proper mental health diagnosis.
Our primary care physicians are not trained to diagnose psychiatric disorders. They have very little training. It's essentially the equivalent of binging on a couple of seasons of Grey's Anatomy. And they do so in Inpatient wards, inpatient treatment programs, so the most severe cases, not in clinical settings with often what's called the worried well. I don't love that term because it belittles, what a lot of the suffering that people have, but it isn't acute suffering and it's not life-threatening suffering. But what we need to do is either let people know that their primary care physicians really aren't necessarily equipped to give you the correct diagnosis so that you don't identify every thought, emotion, and behavior with your diagnosis and over-identify with it.
But even those who are able to see a psychiatrist may not be receiving adequate care. Faye's first experience was with a man she calls Dr. M in her book. Dr. M was her therapist and psychiatrist, but Faye wanted to keep those two separate.
I said I wanted to see someone else for therapy and continue to see him for psychiatry. He said he wouldn't do that. I was too sick for that. And I was out of medications at the time. I didn't have any refills and was very low on medications. And he was very much full of hubris. He was a bipolar expert. He wanted to make sure I knew I was bipolar and wouldn't entertain any other possibilities. So I basically was out of my medications and without a psychiatrist, and my primary care physician had retired, and I was suicidal and in a crisis.
Not knowing what to do, Faye leaned on her family. She calls them the heroes of her story, recognizing the support she's received isn't a given for so many struggling with mental illness. Faye's sister stepped in and found her a new psychiatrist.
We had our initial consultation and it was 30 minutes. And at the end, I just waited for him to proclaim what diagnosis I had now. And I waited for him to tell me a new diagnosis, or the old diagnosis, something like that. And instead he looked at me and he said, "I don't know what you have." And my whole world shifted. And I thought, no one knows what I have. None of you do. And then as I was leaving his office and I was walking down the street, I thought, what are all these diagnoses I've been given?
It was at that moment Faye decided she needed to learn everything she could about how mental health disorders are diagnosed. She's now published her research in order to help save others from going down a similar path.
I'm not anti-psychiatry in any way. I'm pro-psychiatry, I'm pro-medication. I'm just anti a lack of transparency about the diagnoses we're receiving. And I think for the most part, even my doctors who did damage in some ways to me meant well.
And though her story is one of growth and knowledge, Faye thinks a better diagnostic system would have saved her years of suffering. She believes her decades of misdiagnoses stem from the one-size-fits-all approach of the American Psychiatric Association. The APA releases a Diagnostic and Statistical Manual of Mental Disorders, or a DSM. It's more popularly known as the Psychiatric Bible. The DSM is used around the world as the standard for diagnosing mental illness, but Faye says it's inherently unreliable.
No DSM diagnosis can distinguish between normal and abnormal. So in most physical diagnoses, you can have a test or an X-ray that tells you, yes, do you see, here's the abnormality on the X-ray, here's the blood count that is off. You can show where abnormal and normal kind of differ or where they depart from each other. And the DSM and our mental health diagnoses don't have that.
The APA just published the most recent edition of the DSM in 2022, nearly 10 years after the previous version.
In 9 years, in almost a decade, they did almost nothing to rectify the mistakes of the DSM-5.
One change the newest DSM did make was lowering the threshold for certain diagnoses. What that means is if the time requirement for diagnosing depression was 6 months, a lowered threshold would make it possible to diagnose the disorder just after 2 weeks. Faye says lowering the diagnostic requirement can create a false epidemic.
So what that means is that basically it seems like the number of people who have social anxiety disorder or autism or ADHD is going up exponentially because we're finally finding those people, when in reality, the DSM has been revised and the diagnostic criteria has gotten much easier to diagnose. A real epidemic would be, we finally found all these people with ADHD or OCD or whatever it might be, when in reality, what happened was there was a revision to the DSM and suddenly the diagnostic criteria was much easier to apply to more people. And that's why you have more people with the diagnosis.
A DSM diagnosis requires a patient's self-reported symptoms and a clinician's professional opinion. Oftentimes, the clinician is not a psychiatrist. Faye thinks that's what the DSM fails to take into account.
Sometimes I think, and I don't know this because I'm not in his head, but I think they're thinking of the best clinician out there, right? The smartest, the best educated, with the best knowledge and the most sensibility and the most emotional intelligence. And I do think that my psychiatrist is that guy now, but I had a lot of not those doctors, and primary care physicians are doing most of the diagnosing.
Which can lead to an inaccurate diagnosis, like in Faye's case. She hopes her story empowers patients to ask more questions.
We all really want to talk about mental health, but what we're doing is confusing mental health with mental health diagnoses, right? So we all have to take care of our mental health, but depression, the emotion, is not depression, the disorder. And anxiety, the emotion, is not anxiety, the disorder. Yet when we talk about or even write about or read about depression or anxiety, let's say as a result of the pandemic, it can in the next breath go to anxiety disorder, depression as a disorder.
Looking past her own story, Faye recognizes that not all doctors get it wrong.
Sometimes when you question diagnoses, it sounds like I'm questioning mental illness, and I'm not. So even though there are flaws in the extreme with the mental health diagnoses we receive, mental illness is very, very real. I had one. I know many people who struggle with them, and I very much identify as someone who had a mental illness. And I think people who struggle with mental illness are some of the strongest people on the planet, and I take great pride in having survived it myself.
You can find more information about Sarah Faye and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. This segment originally aired May 2022. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.